You are
Dr. Lee.
Dr. Lee?
Yeah, Lee.
Okay.
Yeah,
Pleased
nice to meet
you.
you. Thanks for coming in so early. How are you feeling? How did you sleep last night? It's okay.
He said he was hurting.
Pain in the back? Okay.
In the ER, they gave me some painkillers that was a lot more effective than what they've been giving me since I've been here.
They gave you Dilaudid when you were in the ER. Dilaudid.
It's just whatever they've been giving me here is a pill.
Yeah.
Don't really work that well.
Okay. My guess is that the dose isn't enough for the pain. Yeah, let's change that, because like one of the big things is like we want to make sure that you're comfortable and able to get rest and things like that.
I'm not somewhere okay if I'm not moving. Once I start moving,
Then it just kind of kicks in. Okay. Yeah, let's adjust that. On the floor, we have kind of like two options that I usually will order so that you can kind of figure out what works best for you. We have the idea is like use the pill tablets to kind of keep a more of a steady control, like a baseline pain, so that when you move, it's not like 0 to 60 right away. And then, if you get to a point where it's, bad, you let us know, and then you decide whether or not you want to try to take another dose of that oral pain medicine to try to get that baseline pain kind of at a better level, versus the other option we have is like a subcutaneous, like just like a little kind of shot under here, and it helps absorb fast and then kind of be more of a steady kind of additional pain medicine. So we'll have both of those available for you. I'm sorry that it's been uncomfortable. Yeah. I think, you had the scan overnight. I don't have results yet.
Yeah, what kind of scan?
Like a CAT scan.
Okay.
Of the chest and then like your belly. Hopefully it wasn't too uncomfortable. But the reason for that is because when they did the imaging of your spine, they found some spots there that made us concerned that it could be like a spot of like cancer or things like that, or infection. And so we want to make sure by looking kind of not just at the spine, but having a bigger picture kind of to see what's going on. Yeah, so I think those are kind of the two big categories that we want to look for. I don't have those results back yet, but I should by later this morning. So once we get preliminary results of like what else is kind of going on in like the lungs and the belly, that will really help us figure out whether the spots that are causing this pain are more looking like cancer of some type versus like an infection of some type. Both of those things can land in the bones.
So it's not a kidney infection?
No, it's not a good question. So sometimes kidney infections can lead to that kind of a back pain. But when they looked at your scans and things like that, they found that it wasn't kidneys, but more like something actually inside the vertebrae or like the spinal bone. Yeah. So you definitely have a good reason for pain, and that's why, we're really thankful that you did come in. It definitely isn't, at least we know that it's not like a kidney infection or things like that. But we do have to figure this out. So that's why you're here, so that we can kind of get those answers faster for you, and really get your pain under control. Yeah. Because so that's kind of where we're at. I know there's a lot of questions right now. I hope to get some more answers, like I said. I wanted to give the radiologist a little bit more time this morning to really take a good look, so that I have a good kind of like preliminary report for you. So if they don't finish their report by late morning, I'll call them myself and kind of see, give you guys an estimate of how long they need to get a report.
Okay. And can I give you my number so that you can call me and give me
actually, do you mind? I'll add it to your computer chart. Is that okay?
That's probably
that
in
way,
there.
and anyone and everyone, because if you write it up here, it's good. But then, if it's like if someone's not in your room, then they can't kind of see it right away.
What about the urinalysis?
Yeah, I can pull that up for you right now. So Dr. Shaw and the initial doctors took a look, and that is, not kind of scary or concerning for a urine infection. So, let's see, this is really slow, I apologize. I'm trying to pull it up on here a little faster. I don't know if I can do it in time. Let's see. Alright. Oh, no, it's not going to be. So let's see. So they were checking a couple things. They looked at the protein in the urine, and they're looking for also something called different types of proteins. Because one of the kind of cancers that can land in the bone is something called multiple myeloma, which I think is less likely for you, quite honestly. But to be thorough, when we see anything in the bone or involving the bone, we always send it. So the urine that they were checking was less for like infection, more for just kind of like looking at, are there any kind of indication of like a multiple myeloma, which is like a kind of bony involving cancer. I think that's less likely with your situation. Your creatinine, let's see, I can actually see what not today's because they just took it, but then yesterday's, let's see, it's not outside of what we would expect for you. It was around 12, but that's, understandable, kind of giving your underlying kidney issues. You've been anywhere from 8 to 14 in the past, kind of depending on what day it is. And then here, let me just double check if there's a prelim, not yet. But this is the lumbar spine report. So it looks like the area where you have pain, it definitely kind of, there are spots where you have like areas of the vertebra that are like there's something inside there that wasn't there before, that's not normally there. And so that's why they say, hey, you know what, not only is this probably causing your pain, because it's one of the spots is right kind of in your lower back, but also the radiologist asked for, hey, we need to get more scans to kind of figure out, where are these spots coming from.
So is it like breaking off from somewhere and depositing there, or what?
It's inside the vertebra or inside the spine.
So it's just forming itself?
Yeah. But normally the spine is, doesn't have anything in there. It's just bone.
From too much phosphorus?
Good question. It doesn't look like that kind of a change. So you're right. Kidney patients sometimes have problems with bone issues and like getting too much bone absorbed or things like that. It doesn't look like that, like a simple, what's called a compression fracture, where it's just like the bones are kind of thinned out because of like you said, how you process the phosphorus and things like that. They're actually seeing actual like spots of things that aren't supposed to be there. So that's why they were like, okay, we got to think a little bit bigger. We can't just attribute this just to kidney disease, but we really have to kind of see what these spots are.
So when you say spots, is it like how calcium spots will form or anything like that, or this is?
We don't know exactly kind of what the spots are. The best way to tell would be to ultimately get a biopsy or a sample. But that's why why it's useful to get the scan you had overnight is because we can see, if there are spots elsewhere, and if we do see them there, then, they're easier to get to sometimes to get you the ultimate answer. And I think we're probably going to head down that road. We're going to head down that road during this hospitalization, where we really are heading towards getting like an actual sample of what's going on and looking under a microscope to give you the ultimate answer. Because images are one thing, but it's really helpful to actually see, what's happening under a slide. that can really help us the most, I'd say.
So would that be a biopsy with a needle or something, or?
It depends, yeah. So
Oh,
it depends on kind of what
It depends
we see
on where you
the,
find it.
Yeah, exactly. So like if we see spots like, in certain parts of your body, then then we think, okay, the least invasive, easiest way to get an answer would be to do maybe a needle biopsy, or maybe a colonoscopy, or maybe a bronchoscopy, where like you're asleep and they take a sample like of your lungs while you're kind of awake and breathing, but it's very non-invasive. So we just kind of have to see what the scan shows. It really will tell us the next best step. But I do want to get you that answer, right? So, because it makes a big difference, right? If this is like an infection, or if this is kind of more of a cancer, both of which are treatable. But we do need to find out. Yeah, either way. I imagine that this is not what you were kind of expecting when you came in with the back pain. But like I said, I'm really glad that you did come in, because I would have hated to have you suffering at home with the pain, and also kind of not being able to get to the bottom of this. Yeah, exactly. So I think, although it's obviously not what any of us were expecting, when you first came in, I am glad that you're here now, so that we can truly take the very best care of you and get you all the answers that you need as quickly as possible.
How long do you anticipate him being here?
I don't know. It depends. It kind of depends. Quite honestly, it depends on, in broad strokes, I'm thinking, in these cases, we get the scan that you did already overnight, and then we use that scan to discuss with all the subspecialists to see what would be the next best step, be it more scans, more specialized scans for particular parts of your body, versus getting a biopsy at some point, and then finding the right people to do the biopsy and scheduling it. Yeah, so I don't have an estimate yet, but I would plan on being here for a couple days. Okay, it might be through Christmas, so I apologize. Okay, but that'll give me also some time to come up and for you to help us come up with a really good pain regimen, because no matter what's happening, we want to make sure that you have good pain treatment and that we find the right level of pain medicine, so that you're able to walk around and do everything you need to do, but also not be so sleepy and lightheaded and things like that. So we're going to use the time as well today and over the next few days to figure out kind of what is the way that we can balance your pain with a regimen that you can take at home, meaning pills and things like that.
So what's the pill you're giving him now?
Yeah, so I can bring this up. So these are your list of medications. Right now, you're only on, you're on the higher dose of Norco, which is a combination Tylenol and stronger pain medicine. Given what you're telling me, I think you need a bit more. So the nice thing about Norco is that it has that Tylenol, that anti-inflammatory component, which can be good for this kind of back pain. But if it doesn't work for you, then I suggest we split the two. We put you on extra strength Tylenol scheduled 3 times a day for just the anti-inflammatory part, and then put you on a oral pain medicine that's similar to the Dilaudid that you got in the ER, but it's a dose you can take by mouth. You can continue to take at home as well. And then that's really easy to titrate up and down. Yeah. So I really think you probably need to do that to get better pain control. Yeah. Because I believe you. I think it's not cutting it. Okay. So if you are cool with that, you let us know. The big thing with this is you let me know if you feel like you're getting too lightheaded or too sleepy. And you can even tell the nurses, can I just take, the pain's not as bad, can I just take a half dose or things like that. Also let us know though, if you're on the other side of things, you're you know what, I took it, it's been maybe half an hour, 45 minutes, and I'm still in a lot of pain, how can we ramp this up? And if it's very severe, like I said, we have those subcutaneous or just under the skin kind of shots to just get you through that tough spot while we wait for the pills to ramp up too. So you got a lot of options. We really trust you and rely on you to let us know kind of how you're doing in terms of pain. Okay. What other questions can I answer? I know that was a lot I went through.
So regarding the back and stuff, they still don't, they think it's cancer, but they don't know for sure.
From what the radiologists have seen, it looks like when they've seen scans of things like that, it kind of looks like it's acting more like that. But we really need to, like I said, look at ultimately like tissue or a sample, like you're saying, to know for sure what is there. Okay. We never make a full, we never make a split second, we never make a diagnosis based just on like one scan.
Right.
Because the treatments are very different, right? So that's why the additional scans, and then ultimately I'm hoping, I would say, in these cases, we usually head towards getting, like I said, some sample of a spot, and then looking at it under a slide. We just want to make sure that we sample the right spot with the least amount of kind of like, yeah, exactly, yeah, the spot that makes the most sense to get us a diagnosis, but also not be super invasive. Yeah.
Okay.
Yeah. So, let me just put in your pain medicine right now because I want to make sure that the pharmacy gets that through as soon as possible.
And then I want to make sure you have my number so you can call me with the results.
For sure. How long will you be here?
I'm leaving in about 15 minutes. I got to be at work at 10. So.
Oh my gosh.
Yeah.
Do you work all this week?
Yeah.
Okay. Yeah, for sure. Okay. All right.
Will you be his doctor from here on out, or?
Correct. So we are here for like 7 days in a row. And so today's day 1 for me. So I'll be here throughout until Sunday. Okay.
Until Sunday?
Mm-hmm.
And then somebody else comes in?
Yeah, then it's usually one of my other colleagues. So the nice thing is that we have a really close-knit group of attendings that have been doing it for a long time. So yeah, I'll make sure that everything's kind of settled and we have a good plan in action. And so when the next person comes on, it'll be easy. Yeah. All right, let's see. Okay. Are you Joyce Simmons?
I am.
And is this the right number? Let me just double check. What's the one that's listed for you? Which one's, it looks like this one number is listed. Is that your cell?
Yeah, that's me.
That's it?
Mm-hmm.
Okay, perfect.
And the address is wrong.
Oh, the address is wrong. Well, that's that. Okay.
78, it's the same as his, 7810.
Right.
South St. Lawrence Avenue.
Right. What's the zip for that?
Same.
Okay, perfect. Okay. Does that look good? Okay.
Yeah.
All right. I'm glad we could catch each other before you headed out. And then I'll update you, and then of course update your mom once we get the preliminary scan results back.
Okay.
Okay.
Okay. Please.
Yeah.
What were you saying about the social workers?
Oh,
Yeah.
he's got to have a social
Yeah.
worker. I mean, I saw the guy who is the social worker or whatever, but the issue is that I don't know, how do you push forward to get him what he needs, because him having to go to dialysis 3 times a week, he needs travel through Medicaid. And his Medicaid was canceled for some reason. We don't know why.
You're not the only person I've heard that's happened to.
Yeah, and it's really causing a lot of problems, especially with him having the back issue.
Yeah. Oh my gosh, I can't even imagine 3 times. Yeah, especially if you don't have the transport.
Right. So he's been trying to take an Uber, which is very costly. Nobody has that kind of money.
I mean, no one does really, quite honestly.
But he needs the Medicaid immediately.
Yeah. No worries. We'll be on it.
Please.
We have a kind of like what we call our interdisciplinary rounds where we meet, everyone on the floor meets with together, the social worker, me, the therapist, the pharmacist, everyone together.
But we need them to make
Yeah.
sure Medicaid, the IDHS
Yeah.
people see the urgency.
Yeah.
That's
yeah,
the problem we're
yeah.
having, is that nobody's taking this seriously.
Oh gosh.
You know.
Okay.
So
Okay. I'll have them check
please,
in and yeah.
this is
We'll figure
important.
it out.
So we've been trying to reach them on the phone, and a couple of times he's called and they said their system was down or whatever.
Oh
but
my
it's like,
gosh.
how does that help anybody?
Yeah.
So
yeah.
you guys have got to have some type of secondary
We'll see what we can
solution.
do.
So
Yeah.
please.
Unfortunately, you're not the only person that's happened to, especially this year for some reason. So I don't know why that's been happening, but you're not the only one.
Okay.
So, yeah, I'll pass that on for
Please.
sure. And social worker will probably check in with you to kind of get more details.
And one of the problems I don't understand is with
Yeah.
him having, what is he? They call it end-stage renal failure.
Yeah. Just.
But they don't look
nothing
at that
else,
as being an emergency. They said diabetes is above that, and it's like, how?
Oh, that's weird. I don't know.
How?
Yeah, I don't
You
know
know,
that.
It just,
Yeah.
they're like, well, does he have heart disease? Does he have diabetes? It's like he has end-stage renal failure.
Yeah.
Oh, well, that's not on our list where we can move him up. I'm like,
weird.
it doesn't make sense.
Yeah, that's
So-
weird. Sorry. That's a pain to work through even when you're not feeling, worse than your normal. I'm sorry. Well, I'm glad